I'm going to start with the first question, and we'll get to that. Assuming that the regulatory framework that we heard about earlier isn't the answer alone, because as long as this is a global issue and unproven therapies or treatments are legal in some jurisdictions, that structure alone will not keep patients from seeking unproven therapies, presumably. My question is, do the advertising and professional society structures that we do now have in place, should we just be doing a better job with them, or do we really need to look at this if we want to reach the decision maker who is in fact the patient, who is the one choosing to go for these treatments? Do we need to look at this from a different direction and not necessarily, primarily the people in this room? And as given my perspective, I will say what in there is the role for the patient organizations. And I throw that out to anyone on the panel.
I mean, as I've sat today and listened to the different appeals, I have a much greater respect for the importance of the patient in this whole process than I had previously. I think much of the work that I've done, and even though we've tried to present a balanced approach at ISSCR between sort of professional standards and patient education, I'm really influenced by how important it is for the patient to be both informed and educated, but then fundamentally allowed to have some degree of autonomy. I think we heard a very passionate appeal. I'm not sure I agree with every aspect of the patient appeal, but I think we have to have, as a critical point of intervention, informing the patient and then ultimately allowing a certain amount of the patient flexibility and autonomy to rule the day.
Yeah, I mean, I think there has to be a balance between paternalism and individual choice. And at least at the FTC, our job is not to prevent people from making bad choices. It's to ensure that people don't make bad choices on the basis of bad information. And one of the concerns I have about professional societies playing a principal role or the exclusive role in education is they all have their own interests. And I think that this is an issue that I think government needs to play a greater role in, helping to make sure that information flows freely to the patients who are ultimately going to make these decisions, and figure out what a better transmission belt is. I mean, in preparation for this, I actually spent some time on various websites looking at both the advertising and the available information. And for patients, it must be a very confusing dynamic out there, because the information is hard to understand. It's not necessarily easy to access, and the advertisements are classic advertisements. These are very skilled marketers who are selling hope, and hope is, we've all seen the mythology and the lore of miracle cures. I mean, at the FTC, that's what we do. 1 year it's acai berries, now it's green tea. But for people with intractable disease, it may be stem cells. And I think that, I agree that patient autonomy is ultimately the most important value, but we need to do a better job getting clear information to consumers in a way that they can better understand it.
So maybe I should just preface this by saying here I'm not going to speak on behalf of the ISCT, because I don't know what the ISCT policy will emerge into. So this will just be based on my own personal observations and experience from looking at this issue for about 6 years now. I think actually one of the things that societies, whether it be the ISSCR or the ISCT or any other organization that's interested in this issue, should do is actually something that David alluded to in his talk, which is to communicate with the regulators, not about ways of streamlining the pathway to the market for their own research and development efforts, or for ensuring that the field is adequately served by the regulators in the terms of developing products, which of course is an important function of the societies, but additionally to address the concerns that they have about these business activities so that they can spur activity by organizations like the FTC or the FDA, because what we've seen in the U.S. at least, is that the U.S. has a very well-developed and well-established regulatory structure, of which many companies are clearly in overt violation. So there are companies that are openly breaking the law and triggering no FDA response, by my reading of the law at least. And so I think clearly, at least from David's talk, he said that this had not even really popped up on the FTC radar as an issue. And so I think that's something that groups that have a concern in ensuring the quality development of things like stem cell therapies should do, is communicate with the regulators about their sense of concern or even alarm about this issue.
Glenn, did you want to say anything, or we move to another question?
No, I echo, we deal with this all the time in terms of patient autonomy, and patients who come to us and want to have 4 or 5 or 6 embryos transferred back, and we have certain guidelines, and we say, look, we can't do that because of the risk of triplets and quadruplets pregnancies. There was a study done where, patients, if you gave them the same chance of having a pregnancy, but the risk of twins was 20% higher with one versus the other, patients would take the risk of twins. They don't understand, and I think they have to be educated in terms of what the real risks of doing these things are.
Some of my points have been touched on already, but two points. One, I'm curious about the role of the professional regulatory bodies. So, for example, in Canada, it'd be the College of Physicians and Surgeons. They have a legislated mandate to look at the best interest of the patients. Should they be more aggressive in approaching any clinician that is offering these unproven treatments? For example, in Canada, there is the Zamboni treatment. People know this, the MS liberation treatment. I know this wasn't as big in the United States. Huge story in Canada, absolutely huge story in Canada. The federal government's gotten involved, and one doctor is suing another doctor for reporting him to a College of Physicians and Surgeons for providing this unproven treatment because it's not efficacious. So curious about comments about the role of regulatory bodies in that area. David, a question to you about how the FTC would respond to concerns from an entity like, say, the ISSCR, or is the regulatory body set up to respond to those kinds of complaints, or where does the complaint have to come from? Could the profile be raised by societies, by professional organizations, or even by something like the National Academies of Science?
So let me take your question and defer to my colleagues on the first question. I think the FTC would respond well to, and I think this was the last comment, to overtures by scientific groups or professional bodies that say, look, there's a serious problem. And I think the FTC would be interested in a number of things. One is, what's the magnitude of the risk? That is, what are the physical risks to patients? What are the economic loss? And what is the magnitude of the problem? I mean, one of the difficulties, I think, is, and I looked at many of the studies, there doesn't seem to be any hard estimate of the number of U.S. consumers who are actually engaged in this kind of medical tourism. And one of the concerns the FTC is going to have is, this is a fair amount of work to go after these people. What's our bang for the buck? Are we really protecting many American consumers? Because ultimately, you don't see these kinds of clinics, at least I looked for the ads, there are not that many clinics in the United States offering these therapies. They're mostly offshore. The second is, these are difficult scientific questions, and the agency is going to need help assessing the merits of the substantiation claim. So, it may be that out of the 150 or whatever, I mean, I saw one that had about 85 diseases that were treated with stem cell therapy. But, separating the wheat from the chaff is going to be very difficult for a regulator, and they're going to need professional expertise. So it's easy where the FDA has approved treatments and where they have not approved treatments as a surrogate for scientific consensus. But we all know that the FDA standard for scientific approval is very high, and it is not the same as the FTC substantiation standard. So there may be areas in which stem cell treatment may be, may be viable, but the scientific jury is still out. And those are difficult cases for the FTC. That is, if there are respectable arguments to be made on both sides of the argument. I think the agency would be less inclined that if you could come in and say, look, well, there is not adequate science one way or another, there are high risks, and there doesn't appear to be much evidence of any benefits. Those are the kinds of cases I think the FTC would be much more interested in intervening on. So I do think that there's an opportunity to engage with the agency. I think that there are instances in which, even in the absence of consumer complaints, and I think there is an absence of consumer complaints in this issue, the agency would step in to prevent serious imminent harm to consumers.
Alta, do you have a question?
Well, actually, it follows up very directly from this, because if I'm hearing, I was muttering to Adam on the side about this, what I feel like I'm hearing is two separate issues. One is who gets to decide what's true, and we heard earlier some discussions about what are the most credible sources of information and which sources should be discounted, with disagreement among people about that. And the second, which is a distinctly different question, is given accurate information, what is good enough to be marketed and what is not good enough to be marketed. So on the question of who controls truth, if I'm understanding, David, what you're saying, from the FDA's point of view, everything is presumed to not be proven safe until the FDA has said, you've given us enough. In other words, it's presumed false until proven true, whereas from the FTC, it's sort of the reverse. There's a presumption of truth until you can prove that the advertising is false, leaving this kind of gray zone in the middle.
No, I would describe it differently. I think
Okay.
I think you accurately described the process before the FDA. The FDA, the proponent has the burden of proof, and the burden of proof is quite high.
Right.
With the FTC, the proponent has the burden of substantiation. So if you're making a claim and there is no substantiation, it's false under our statute, because the claim implies that there's some level of substantiation. On the other hand, what the agency worries about is when the science is in equipoise. Suppose there's science on one side and there's not science on the other. That's a difficult position for the agency. It's not a difficult position for the FDA. The FDA says no. The scale has to tip decidedly in your favor before we give you a green light. That is not the same standard that the FTC implies.
Well, then let me just, given that clarification,
Sure.
I thank you. I think we can all appreciate the potential role of patients as individuals and of patient organizations as representatives in the second question, which is really a value judgment of when is it good enough? And that's a very classic argument, and it's, in some ways, it's the Abigail Alliance argument over and over and over again about when is it good enough given people's different, valuations, tolerances for risk and uncertainty. But on the question of this kind of burden of truth and substantiation, what role is there for patient groups or for individual patients in that? Because we've heard about the role of expert groups, presumably journal editors that control what gets published and their own peer review process. But I know that we really want to figure out how we can incorporate constructively the role of the patients in this kind of discussion.
Well, I tried to allude to this before, and I'll come back to it. I mean, the agency is looking for harm. We're not the truth squad out there just in a vacuum judging the quality of the truthfulness of information. What we're trying to do is avert harm. And if the patient groups come to us and say, we are worried about these particular therapies because we don't think they're adequately proven and they pose a risk, that's something the agency would take into account. On the other hand, if the patient groups say, please stay away, because we think these therapies, even though they may not be proven to the FDA satisfaction, have some merit, and there is some science to support them, there's a biological plausibility to them, that's something we would take into account as well. Okay. Our commitment is to protect consumers, not protect abstract scientific debates.
Thank you.
So, Alta, if I could just follow up on that a little bit then. I would say that, and again, as I started, as long as there's jurisdictions in this global world where procedures are legal that are not able to be marketed here, the role of the patient organizations will have to be education of the patients, so that at least if these decisions are being made, they're being made with good information about what is unproven. And I don't feel in this conversation that the patient organizations play that role right now.
Yeah, I just want to make a few comments. I think the patient organizations can be enormously influential on the demand side of this equation. What I've heard several people say now, and I think it's coming into focus for me, is that we have offered a lot of anecdote about the problem, but despite the fact that many of us are scientists, we don't yet have really the quantitative information to really define the problem. And so if we don't have that, it's very hard for us to really judge the proper interventions. Should it be more on the regulatory side? Do we have enough regulation? Do we have too much regulation? I'm not sure we really know. How effective is the regulation we have, and how effective would new regulation be? But on the other hand, what's really impacted me, because I wanted to come here with a very open mind, and I have to say that I've been getting barraged with requests to review a lot of these commentaries for various journals, which present this sort of other side. I mean, I'm seeing it from the kind of orthodox side, the orthodox model of clinical investigation. But what I'm hearing now is from the behavioral economists and from the patient advocacy groups that there's another side to this. And it may be, if we quantify that potential impact, we could have a better impact. So the ISSCR, for instance, now has the charge and maybe some of the resources to actually do better communications around many, many issues, but a large part of it is going to be targeted towards trying to have an impact in education, and maybe the sweet spot is hitting the patient advocacy groups.
He was next, and then he raised his hand before, and then we'll get to you.
There was a point raised by Douglas, about the definitional problem with stem cell tourism. I'd agree with that, and after working in the field for a number of years, I think there are problems with the tourism designation and the stem cell designation as well. And I do wonder how we get around that definitional ambiguity. You suggested something like the ethics of unregulated direct-to-consumer patient marketing, or something like that, sort of a clumsy term which tries to encapsulate some of the concerns that have been expressed. But I wonder whether any definition is going to solve a problem, because it depends on what the ultimate aim of regulation is. And I think that we've just heard that patient groups are likely to have a different set of concerns from people who are concerned with advertising. And I think scientists' concerns and science bodies' concerns are often pertain to the ultimate effect upon the legitimacy of science and public trust in science. And we saw with the nanotechnology debate in the UK, which I followed quite closely, and the media reporting, the science community's response was very much shaped by media coverage. In that case, the media coverage of Prince Charles' comments on the purported grey goose scenario in 2003, which led to the setting up of a Royal Society, Royal Academy of Engineering working group to look into responses to nanotechnology, and there was a working paper that came out on the back of that. And if you look across different technological fields, often controversies arrive, and I think this is a controversy, if you like, which has arisen within the stem cell field. It's often a deeper concern about the impacts on the longer-term impacts on science, and I think people in the stem cell science field, and I had this said to me, are concerned about the ultimate impacts. That's not necessarily the concerns of patient groups. So I think we need to be very clear about what it is we're trying to regulate, and that will very much shape the language we use in talking about the issue. And the stem cell tourism designation, I think, is a media-generated term, and I use it in my own study because it's short, sharp, people know what you're talking about. And in fact, we use it on our own website for recruiting patients. And we had a long discussion about whether or not that was an appropriate term. But if we put stem cell treatments or experimental treatments or something like that in the title, then we'd attract interest from people who are looking for the quick fix. And that's not what we wanted. So it's just, I guess, a plea for more reflection upon what it is we're aiming to achieve from regulation, and to think about, whether or not we can reach a more adequate terminology for describing this field.
Well, as I mentioned, I haven't really stumbled across the perfect term that is equally readily understandable and accurate without being facile. One term I did use briefly was stem cell pseudomedicine. So it was the idea, and this was based on the idea that I think any term that's going to accurately capture the phenomenon has to not focus on the patient behaviors, but on the behaviors of the providers, of, in many cases, companies that are doing this on a for-profit basis and are actually driving the activity, because that is the target of the regulatory activities as well. If you think about all of the different attempts to regulate or control this type of market, there has never been a regulatory activity that has focused on a patient. So no patient has been arrested or disciplined or warned or served an injunction, or any kind of action has been taken against a patient. All of the activity is looking at controlling the supply side, the providers, the companies that are engaged in this business. And so I think any term that is talking about this phenomenon should shift away from talking about what are the patients doing, as if it's the patient's responsibility, and look more at the responsibility that is engendered by making these types of claims or suggestive, marketing statements.
I was on the FTC. I don't want to take up anyone else's time. Can I go back?
Okay. Come back to you. So let's say that we go a step further. So, Amy, you met and both you and George made the comment that perhaps we should spend more time focused on the patient support groups. And I guess if I think about that a bit more, what exactly would you do? I mean, could you just think through the process, because on the one hand, we have an individual who represents the patient, and would that patient support group be like him? Would that patient support group be receptive to whatever you're going to be saying to them? Because remember, they're talking about individual desperate patients who are looking for some type of cure. So I understand what you might do. You might say, let me present the science about what? About stem cells and multiple sclerosis? It's going to be kind of a challenge, I think, to implement what you might be thinking as you get down to the gritty details of how you would approach it. More of a question to really pursue.
No, what I'm trying to advocate for is listening to that perspective more, and keeping our mind open to what the needs really are. I think that the entire discussion obviously presents an opportunity for tension. I mean, there's a role to be played for the kind of paternalistic regulatory side. I think we all appreciate that. As a strong advocate for a kind of post-Enlightenment standard of evidence-based medicine, I really feel that that's important. And there are fundamental asymmetries of knowledge and information. And, as a physician, I feel like I have, some privileged perspective. I'm called upon many times by family and friends and patients to try to use that perspective. So I think we're steeped in that. I think we're here at the National Academies and the Institute of Medicine. We are steeped in that sort of tradition. I'm just not sure, and what I'm hearing is there's a perspective to come from the needs, the spiritual needs, the hope, the distress. It's been mentioned, but I would advocate, and if I'm coming away from this meeting, I think we need to listen more to that. I think there are points of intervention, there are opportunities. We talk about education and communication. There's enormous new opportunities using sort of social media, using the internet. Those forces are being used in a sense against the orthodox view. Let's figure out a way to use them to our advantage so that we can actually serve the needs of patients in a better way.
I just can I make one comment. We also work with patient organizations quite a bit. There's two organizations, Resolve and the American Fertility Association, which we work directly with. And I'm surprised that there's such a confrontational aspect between patient organizations and physicians. Is there any way that you could educate some of the patient organizations so that they are more responsible in terms of being able to educate people that talk with them? And obviously, I think a physician has a duty at some point to discuss risks with the patients, and it becomes a burden. But other patient organizations interact with these patients all the time. And they are a great resource if you can educate them in terms of what the real science is, that they might be actually a resource for you, not a source of confrontation.
Yeah, I would, if I want to say that as a patient organization representative, I think it's incorrect to assume that a patient organization will take, for lack of a better term, the most extreme position on the interests of patients. My organization will try very hard to educate with accurate information, but we have at times advocated that something not be approved for the FDA, by the FDA, for example, because there wasn't adequate science to support it. So I think one shouldn't assume the patient organizations will automatically argue for the loosest, most extreme position. And interestingly, studies that I've seen have shown that patients tend to trust patient disease-specific organizations more than almost any other entity for information about their disease. That may not apply to their own doctor, but aside from that. And so use that, take advantage of that. But I would suggest that patient organizations won't, I'm assuming, would not be comfortable taking on this issue by themselves. The ISSCR experience would apply just as well to my organization. If my organization were the only one that started taking on the Amy's Blood is Boiling standard, and we put stuff on our website, but none of the other neurological organizations are doing this, that would be uncomfortable for me as the CEO. So I would suggest there's opportunities for coordination so that we're sharing, it's the same sites, they're usually lumping all these diseases together, so that if we could work in a more concerted effort, there might be opportunities.
Can I go? I'm going to save my FTC question
I'm
for
going
you
to
after.
say, I'm going to use the moderator's prerogative because there's one more question behind you, and then we have
But
to
mine's
stop.
not an FTC question.
I know, but we have to stop.
Look how upset I am.
I've been asked to be really tough. I can be tough.
No, I was, okay. Am I the last one? But anyway, I just wanted to say, I don't think it's correct to say that patient organizations and professional organizations don't work together. Hopefully you weren't saying that. But there's a long history of them actively working and engaging at the professional organization interaction. And actually for the Abigail Alliance, there was a whole stream of cancer organizations that actually did not support that. So there were, that they did not think that was the appropriate way to think about expanded access. So I'm just saying maybe we haven't utilized them for this particular topic to actually have more of a conversation about it. Because there's a lot of different professional organizations where such a topic could come up, but I don't think it has in the disease-related professional organizations.
Yeah,
Just
I would
a comment.
agree. I certainly don't think they're at odds, but you're right, they haven't been utilized.
Let me comment briefly. As the non-scientist in the room, I'm sort of stunned by the lack of sort of scientific rigor with some of the papers here, because to me, the key question is, what is the patient's experience? The word tourism is extremely disparaging of people who are desperate and go out of country to get therapies that they think may be helpful to them. I think the word is a bad word for a different reason. I just think it's insulting. But the real questions, it seems to me as a regulator, are what are these experiences? How many people are going abroad? Are they happy with what happened? Are they unhappy? One of the things that I take as a real sign is we don't see any complaints. I mean, I'm sure that there are people who are going to complain, and it may be that they're just unaware of the fact that there are mechanisms to complain to the federal government. But this is not an area in which there are complaints. And so I think engaging with the patient community is really essential, because the one key question, what is the experience of people going abroad? That doesn't seem to have any answer to it.